Scanning the room. Hi, my name's Hannah. I'll be your student nurse today. Just providing privacy, getting hand hygiene. Can you state your name and date of birth for me, please?
11/5/2000.
All right, I'm just going to check on your wristband here. Perfect. Your provider asked me to come in today to do a neurological assessment. So basically, I will just be looking and checking your reflexes just to make sure there's nothing abnormal. Would that be okay for today?
Yeah.
Okay. For this assessment, I will be needing PPE, but I will put gloves on when necessary. Do you have any allergies I should be aware of before we begin?
No.
Okay. So before we begin, all of my equipment is sanitized and cleansed, ready for the assessment. Are you in a comfortable position?
Yep.
Okay. So just a couple questions here. Have you ever had a stroke?
No.
Have you ever had facial trauma?
No.
Do you have any pain or tenderness to your face at all? Okay. Some alert or some behavior questions. Your facial expressions are pleasant. Your attire and grooming is good. Can you tell me what brought you in today?
Physical.
Okay. Do you know where you are today?
Southwest Tech.
Can you tell me what year it is?
2023.
Okay. So for my immediate question, I am going to say 3 words or 3 numbers. Can you repeat them back to me? So 1, 5, and 8.
158.
Can you say them backwards?
851.
Perfect. And then for my next question, remote. I'm going to say 3 words. The 3 words are blue, table, and horse. Can you repeat those?
Blue, table, horse.
Okay. And within the next 5-10 minutes, I will ask you to repeat those. For my recent question, are you married?
No.
Okay. So I'm going to be assessing the cranial nerves today. So I'm going to begin with the olfactory. So I'm going to have you close your eyes, and I'm going to have you plug one nostril. And can you tell me if you smell anything? What do you smell?
Minty.
Okay. And then on the other side?
Minty.
Okay. And then for the next assessment, I am going to have you hold this piece of paper, and I'm going to have you shut one eye and then read the bottom line out loud.
LTFPH.
And then can you do the same on the other side?
LTFPH.
Perfect. And so then for the next assessment, we will be covering oculomotor, trochlear, and abducens. So I am going to do with the pen light here, I am going to have you follow the pen with your eyes. Do not move your head. Okay, perfect. Your pupils looked good. Your eyes weren't shaking at all. Let's see here. And then, so next would be the trigeminal. So I am going to use this gauze here. I'm going to have you shut your eyes, and I am going to be hitting 6 points on your face here, your forehead, chin, and feet. Can you just tell me on which side the gauze is on?
Left forehead. Right cheek. Left chin. Right side forehead. Left cheek. Right chin.
Okay, perfect. And after trigeminal, I will do the facial nerve. So I'm just going to have you smile for me, and then I'm just going to have you frown. Okay, and then next I will do the acoustic. So I'm going to come around you here, and I am going to do the whisper test here. So I'm going to have you place your finger over your tragus and just rub softly. And I'm just going to repeat some numbers, and I'm going to say some numbers, and I'm going to have you repeat them to me. 1, 1, 5, 2, and then on the other side, 8, 4, 5. Okay, perfect. And then next I'm going to do the glossopharyngeal and vagus. So that would require my PPE. Okay. To remove this here. And then I'm going to have you open your mouth and stick your tongue out for me and say ah. Perfect. And then can you just swallow for me? Okay. And I forgot to ask you during the optic assessment, do you wear contacts at all?
Yes.
You do? Okay. Good to know. Okay, so then after the glossopharyngeal and vagus is the accessory. So I'm going to come around to you here again, and I am going to have you shrug your shoulders, and I'm just going to apply pressure and see if anything is abnormal. Nope. Okay. And then last nerve here is the hypoglossal. So I am going to have you stick your tongue out for me and just go from side to side. Okay, perfect. And then next I'm going to be hitting the superficial points. So I'm going to have you close your eyes, and I'm just going to be hitting 4 points on your upper extremities and then 4 points on your lower extremities. And can you just tell me where the pen is located?
Right side arm. Right side wrist. Left side wrist. Left side arm. My right knee. Left ankle. Left knee. Right ankle.
Perfect. And then next is the stereognosis. So I am going to have you close your eyes, and I'm going to place an object in your hand. Can you place your hand out for me? And then can you just tell me what you feel?
A coin.
Okay. Then I'm going to place an object in the other hand, and can you just tell me what you feel?
The coin.
Okay. And then for the next one, and so it's the graphia. I am going to have you place your palm out, and I am going to draw a number. Can you tell me what number it is?
7.
Okay, and then I'm going to do the same thing on the other hand. 2. Okay. Next, I am going to have you lay flat on the bed with your shoes and socks off. And I'm just going to apply PPE because I don't. Okay, so this is cleansed, ready for use. So I am just going to be checking the superficial plantar reflex. So I'm going on the outer part of her foot here, and just seeing if there's a reflex, which there is on that side, and also that side, which is good. So this is cleansed. My gloves here. You can sit up and put your socks and shoes back on. So that should complete our assessment for today. While I am here, is there anything else I can do for you?
No.
Okay, so before I leave, your bed is lowered, your side rails are locked, your table is within reach, your call light is within reach, your pathway is clear of any object or obstructions that could cause fall. I will do hand hygiene. I'm just covering over everything. All of my equipment is cleansed and sanitized after use during the assessment. Okay. I am going to exit and go document.